Good afternoon, sir. My name is Jeremy. I'm going to be your student physical therapist that's completing this telehealth eval with you. If you have any complications with hearing me, just let me know. Sometimes I might look away from the screen. It's just I'm writing some notes down or looking at another screen, okay? All right. So go ahead and give me your name and date of birth for me.
My name is Christian, and I'm 31 years old.
Nice to meet you, Mr. Christian. And what's bringing you in today?
So I've just been, having some pain in my knee. It happened a while back. Well, not really a while back, but it happened about 3 days ago. I was out in New Zealand, and I was rock climbing.
Okay. And what happened during that rock climbing?
So I'm just doing my thing, and my left leg it slipped off of a rock,
Mm-hmm.
and I had to catch myself kind of with my right leg.
Okay. So is it your right leg or your left leg that's bothering you?
It's my right. It's my
Your
right.
so the leg that you kind of caught yourself on.
Yes.
What did anything happen when you caught yourself? Did you land
It
on
kind
it
of turned
funny?
in. It buckled a little bit. It turned in, and then I think I heard a pop.
Okay.
Honestly, it could have been like me psyching myself out, but I'm pretty sure I heard a pop.
Okay. And when you say it turned in, here, let me let me kind of demonstrate. When you see my knee,
Mm-hmm.
so when you turned in, did it go like this?
Yeah, kind of yes.
So you caught yourself and kind of went like that.
Yeah.
Okay. Just checking. I just wanted to make sure I kind of understood what you were saying. So you landed on the right and it turned in and you heard a pop.
Yes.
Okay. It does. Your left one is okay though.
Yes, my left is fine.
Your left foot or your right foot?
Foot is there's nothing wrong with my feet.
Oh, your knee. I'm sorry.
My knee, yeah, my left knee is fine.
Your left knee's fine. Your right knee's the one that's bothering you.
Yes.
Okay. Perfect. And you said it was, you heard a pop, right? Okay. Um, anything else that you would like to kind of explain
Um,
on?
went to the doctor yesterday because I got back home,
Yeah, I saw
and
that.
they gave me crutches. Took an X-ray,
Okay.
and
What the X-ray show?
for didn't just said it was negative.
Okay.
Director is negative, and then it just referred me here.
Okay. How are the crutches treating you?
They're fine to keep me off because usually when I put weight on my leg, when I put weight on my leg from walking, um, I definitely get a sharp pain.
Okay. Okay. So is that like at any point when you try to put weight on it, it hurts?
Um, yeah,
Like you get
at
that
any
sharp
point when I
pain?
try to put weight, even when I'm trying to put my feet in my shoes, honestly.
Okay. And I know you said you feel that sharp pain. Is it a sharp pain all the time, or just when you try to put that weight on
I
it?
want to put that weight on it.
Okay. What would you describe that pain if you're just, day to day?
Yeah, just sharp. That's really the only way I can
Okay.
describe it. It's
Does any does anything else bother that pain?
no, just putting it on.
Okay. So putting weight on it and then putting your shoes on.
Yeah, and then, but then also, when I try not to put the weight on, then I end up not moving it, and so it gets definitely gets stiff and swollen.
I gotcha. Okay. So you do notice some swelling compared to the other side.
Yeah,
Okay.
definitely.
Okay. Has that swelling gotten better, worse, or stayed about the same?
It's still about the same because it's like I usually notice it the first 30 to 40 minutes. Like if I'm just sitting there for 30 to 40 minutes and don't move, I
Yeah.
definitely notice it.
Okay.
Or first thing in the morning.
Okay. So if you've been stationary for a little bit,
Yeah.
you notice that swelling.
Mm-hmm.
Gotcha. Um, going back to that pain, if you could rank it from 0 out of 10, 10 being the worst, what would you put it at? When it's that sharp pain,
When I get that sharp pain, probably an 8.
an 8. Okay.
Mm-hmm.
And what when it like right now, what would you rank it at sitting here?
Uh, when I mean, right now it's not really giving me any pain. well, not really too much pain. I can't really tell you. I guess, yeah, I can't really tell you, but I can tell you when it feels at its best.
What was it at its best?
It's a 2 out of 10, and it's usually while I'm resting and my leg is elevated.
Okay.
Then, but then it just feels kind of just like a vague, kind of just deep ache in the background when it happens.
Okay. So when you're resting, it's a deep ache.
Mm-hmm.
But when you try to use, like, put weight on it or put your
Yeah,
shoes on,
it's like that
that's
sharp,
when that sharp pain kind of
pain
comes
that's
in.
like right there,
Okay.
sudden. Yeah.
And then you have swelling. Okay. All right.
Yep.
So you said you saw your doctor. They did X-rays. X-rays are negative. They send you over to me to kind of do further assessments. You said you're taking medication.
Um, no, not for this. No.
Okay, no medication.
Actually, excuse me. Yes, I am taking a anti-inflammatory.
Okay.
Apro.
Okay, so anti-inflammatory medication. Is that helping?
Um, it helps with the feeling of the stiffness, but it definitely messes with my stomach.
Gotcha. Um, couple quick questions before we move on. Have you had any like abnormal weight gain, weight loss, nausea, vomiting, anything like
Nope.
that? Fever, chills, night sweats.
Nope.
Okay. Have you felt like your shortness of breath or kind of like your heart's fluttering?
Nope. Not at all.
Okay. Good. Do you have a family history of like blood clots, like a blood clotting disease or anything like that?
No, sir.
Right. Okay. Do you have any forms of like diabetes or hypertension type disorders?
Nope.
Okay. Good to hear. Good to hear. So it kind of sounds like you're having difficulties weight bearing. So what do you do for work?
I'm a VP of a computer programming company.
All right. And does this bother you at all doing work related stuff?
Work related stuff? No, not really.
Okay. What about at home?
I mean, yeah, just moving around. Because I'm just avoiding putting that weight on my legs, so I really haven't attempted walking or anything like that.
Okay. So just kind of seems like walking is the main issue right here.
Yeah, I mean, want to get back to doing what I like to do because
Okay.
I live on in a beach house, and so I like going out to the beach. Also, like
Yeah.
rock climbing, surfing, running.
So pretty active. A lot of
Yeah,
hobbies. Any issues before this injury doing any of that stuff?
nope, not at all.
Taking care of yourself, cooking, cleaning,
Yep,
going to work?
yep.
Beautiful. And now, how are those activities after the injury?
Unable to do them just because I said I just get that
Yeah.
excruciating pain
Gotcha.
whenever I try to put weight on my leg,
Weight on
through
it.
my right leg.
Have you had any? I just lost my train of thought. I apologize. I really forgot what I was going to ask you. I had something on my mind. Anyway, we're gonna move forward, okay? So what I'm hypothesizing is that you might have torn a ligament in your knee because of that pop sound that you're talking about and difficulty weight bearing. But what do you want to get? What are your goals out of physical therapy that you want?
I just like to return to my activities without pain.
Okay.
And revisit New Zealand, man. It was a really nice place.
I got you. So I'm kind of going to recap a little bit back to you, all right? Kind of hit the key points. So about 3 days ago, you were rock climbing, you slipped, you fell, but you caught yourself when you landing on your right leg. And when you landed, your knee kind of turned inwards. And then you heard a sharp pop, or you had pain and you heard a pop, you think.
Yep.
And then since then, you can't really put weight on it. You went to your doctor, they just did x-rays and sent you to me, gave you some crutches, and using those crutches it's been beneficial, but you want to get back to being able to do all your activities without those, being able to fully weight bear on that leg without any pain, all right? At its worst, it's an 8 out of 10, and it's that walking that makes it that 8 out of 10, correct?
Correct.
when you try to put more weight on it?
Yeah, I mean, yeah, just anything at all. Like I say, even
Okay.
when I'm trying to put my feet in my shoes, I can get that sharp pain.
Gotcha. And then at its best, it's a 2 out of 10 when you have it rested on elevated. And you notice some swelling, mainly in the mornings, or if you stay stationary for a little bit too long. I think you said 20 to 30 minutes.
30 to 40.
30 to 40 minutes. And then that swelling kind of comes on, making that knee feel stiff, right? At its best, it's still a deep ache, right? Can you point or show me to where that pain is? I forgot to ask.
So
You can move the camera if you need to.
yeah, I was about to say, I'm about to move you back. Okay.
That's fine.
So I'll say just deep here. Deep,
Okay.
deep.
In the front of the knee.
Just yeah, I wouldn't really call it the front, but it's
Can you?
kind of. I would say it's more so inside my knee.
Okay.
Rather than in front of my knee.
So you feel like you can't touch it.
Yeah, I can't touch it.
Okay. All right. So yeah. So you want to get back to that, doing all your activities. You got that deep pain. Do you feel like I missed anything? You're taking medications to kind of help with the inflammation that's present, but you don't really feel like it's helping with the pain, correct?
Yeah, no, I wouldn't say it's helping with the pain. It's definitely helping with the stiffness.
Okay.
But not more so with the pain. And like I said, it just messes with my stomach.
I got you. Messes with your stomach. All right. So we're gonna go ahead and move forward in the examination. All right. So what I'm hypothesizing, like I said before, is either you tore a muscle or a ligament due to that popping sound. And then the pain with the weight bearing and where you're saying that you're touching and the swelling and all of that just makes me think that you kind of tore something. All right. So we'll go ahead and move forward. Do you have anything to take your vitals, like a blood pressure cuff or anything?
Yes, I do have my own blood pressure cuff.
Okay. So we'll go ahead and take your blood pressure. And do you have like a pulse ox or anything that you can put on your thing?
No, I don't have a pulse ox.
Okay, that's fine. So yeah, do you have is it an automated one?
The blood pressure cuff?
Yeah.
No, it's the standard with a.
Okay, so a manual one.
Yes.
I got you. That's okay. We'll move on. If it's not an automated one, I'd rather not take it. Do you have any lightheadedness, headaches, anything like that? Do you feel like tightness in your chest or anything?
Nope.
Blurry vision, lightheadedness when you move around?
Nope.
Okay.
I just went to the doctor and took my blood pressure. It was at 110/79.
Okay.
Yesterday when I went, and then I'm usually about 72 pulses.
Okay. And what about breathing rate?
about 10.
10. Okay.
Yeah, I'm in shape, so.
All right. So the steps I would like to do is special tests. I would like to do PFC as well, PFT. And then I would also like to do AROM and PROM. Okay. All right. So I kind of want you to just kind of match my motions at first. All right. We're going to do a quick screening. Can you take, I'm going to scoot you down a little bit. Kind of seated in a chair, right? So can you take your right knee and lift it up as high as you can go? Yeah, okay. And then can you take your left one and bring it up? Good. It looks about any pain or anything?
Nope.
All right. Do you feel any weakness?
Nope.
Good. So I forgot to mention during any of these motions, what I'm looking for is either pain, weakness, or tightness. If you have any of those, just let me know, okay?
Okay.
And then if you feel like you can't, it's uneven on one side compared to the other, I'll be watching. But if you feel like it's uneven one compared to the other, let me know, okay? All right. So the next one, what I want you to do is kind of take your knee or your foot and try to bring it in like this. All right. So look like that.
Do you need me to lift it up and move it over to the same time, or just?
Just turn it in. I was just lifting it up so you can see. Yep. And then bring it back to neutral, and then do the other leg. Bring it in like that. Any issues?
Nope.
All right. So now we're going to take our foot and bring it out as far as we can go. Bring it out. Yep. Good. Bring it back. And then the other side. Good. A little limited on that side. Any pain?
No.
Okay. So now what we're going to do is take your knee and kick it straight out.
That one, I had some I wouldn't say pain, but it's definitely just a little stiff.
Okay. Okay. And then do your left side. That one looked a lot easier.
Yep.
All right. So next one, I want you to scoot a little bit forward into your seat. And then what I want you to do is try to bring your knee to your butt. Or your heel to your butt. I'm sorry.
It's okay. I understood you.
I gotcha. Any pain with that?
Definitely just had some stiffness there. I had to work out first.
I gotcha. And then the left side? Good. Anything there?
Nope.
Alright. So next one's your toes. Alright? I want you to try to bring your toes up. So I'm going to scoot you down a little bit so you can see my feet. So I want you to do that. Alright?
Sorry, I'm not comfortable, so I don't have on shoes like you.
That's okay. Bring your toes up. Good. And the other side. Good. They look pretty even.
Yep.
Alright. And then the next one, bring your toes down. Like you're pressing on the gas pedal. Good. And then the other side. Any issues there?
Nope.
Good. Good here. So it kind of sounds like just bending and straightening your knee is the issue, right?
Yes.
Alright. So, what I want you to do is kind of take your hands. I'm going to teach you how to kind of feel for what I'm looking for, alright?
Can you repeat that again? I'm sorry, my connection got a little spotty just now.
It's okay. I'm going to teach you how to feel around your knee and what I'm looking for, alright?
Okay.
So you got shorts on. I'm going to show you through mine. So you can just keep your knees bent, kind of like this. We're going to start on your good side. What I want you to do is take the back of your hands and kind of feel around your knee, alright? What I want you to do is kind of compare both sides to each other and feel for any warmth. Okay. Do you feel anything?
So, just on this side, I feel like a little bit of warmth.
Okay. Where do you feel?
Definitely have that swelling on my right side.
Okay, so you feel a little bit of swelling. And where do you feel that warmth?
I feel that warmth just kind of like, really all over.
Okay.
But I definitely kind of feel it.
Anything in the back?
More so kind of like around, more so like around here, really.
Gotcha.
Like I guess like the midway point of my knee right here.
Okay.
Kind of more so. I feel a little bit more.
Okay. Anything in the back?
That's where the swelling is at too. Sorry, say that again.
Anything in the back?
Nah.
No. Okay. I also kind of want you to feel for what we call the joint alignment, right? So if you feel your kneecap, right? If you're just resting it with it slightly bent, completely relaxed. If you feel your kneecap and go down to just straight down, yep, just like that. Do you feel a little like a lag or like a step down or anything like that?
I mean, no, not really.
Okay. Compared to the other side. Do it on the other side too. Does it feel the same?
Yeah, it feels the same.
Okay, good. what I want you to do is you feel that kneecap. Does it feel like it's in the same position as your other one, your other leg?
Yeah, they do.
Okay, good. And then if you take your kneecap, staying right in the middle of it, find the middle of it, and you come in and out, you should feel two kind of like bony landmarks. You feel those?
Yes.
Okay. Do they feel pretty even compared to the other side? Like same alignment?
Yeah.
Okay. Good. Alright. So we're going to go ahead and move on to the next one. So active range is kind of similar to what we were looking for during the screening. What I want you to do now is kind of turn, because I want to see how far you can go. I want you to take your knee and then kick it as far out you can go, starting with your left. Raise the camera up a little bit, just so I can see. There you go.
And let's see. So I probably make it to. So probably make it to about right there.
Okay.
If you can see it, I can grab it.
Yeah. It looks like you're a little limited.
Yeah, I would say so.
Okay.
So I can grab another chair if you need it.
To prop me up on, or?
I mean, just so that I can just fully turn to the side.
No, this is okay. I got a good enough view.
Okay.
Any pain with that action?
Yes.
Where's that pain
I
at?
just get that. Like I said, it's just kind of deep in my knee.
Okay.
And I will say, it kind of felt like I was just a little scared, so I feel like I had some muscle. Like my muscles just, wouldn't kind of let me go all the way.
Okay, so you feel like your muscles kind of telling you need to stop?
Yeah.
Okay. So do the other side for me. The left side.
Gotcha. Like this one is fine.
Yeah, that looks good. That looks like full range. All right. So for the next one, what I want you to do, if you can stand up and just kind of get something, your crutches or something. All right. Kind of angle this. What I want you to do is just try to bend it as far as you can go. All right. So kind of like that. Is that as far as you can go?
Yep, about right there.
Okay. And the other side?
I said, once again, it's kind of just feels like my muscles are kind of just stopping me.
I got you. All right.
My other one is.
Good. All right. Go ahead and sit down. All right. So for this next part, what I want you to do is called passive range of motion. So I'm going to show you how I want you to do this. All right. So I want you to take your left leg, hook it underneath your right one. All right. So it's hooked like that. And then what I want you to do is use your left one to straighten it out. I want you to keep that right one relaxed. All right. So look like that. Yep, just like that.
Still about, I wouldn't say I got all the way, but definitely got more that time.
How's the pain?
It's the same.
Same pain? Deep?
It's sort of kind of just deep. Yeah.
Okay. What would you rank it at on that 0 to 10 scale?
Probably that 2 out of 10.
2 out of 10. I got you. Okay. So now what we're going to do is do that same thing on the other side if you feel like you can. I know the right leg's bothering you, so.
Yeah, I probably won't be able to get it. Like I said, I think
That's okay.
this one, if it'll help, I could just put it right here.
Yeah, I mean, that's okay.
Okay.
That looks good. Now for this one, we're gonna kind of do the same thing. You can keep your knees a little bent, right? But I want you to take your left leg, put it in front this time, and then try to bend your left one as far as you can go. Bend your right leg. So
Gotcha.
left leg in front, bending the right leg. Yeah, like that. As far as you can go. How's that one?
Same, just same. Same that same pain.
So still pain. It looks like
Yep.
it's getting more range too.
Yeah, definitely. Went back farther that time.
Okay. All right. So next thing I kind of want to do, um, is what we call uh, special tests. All right. So if you can, prop your leg up on, um, or you can keep it bent. So on the floor, kind of like this. All right. So you're going to keep your knee slightly bent. You're going to have that support from your chair. And what I want you to do is place your right hand on your upper leg like that, and then your other leg on the bottom on your calf. Yeah. And what I want you to do is just do a quick little jolt with your bottom hand forward, so like that.
Okay.
Okay?
What you kind of say? Kind of like that.
Yeah. Yeah, like you're trying to push your calf forward.
Yeah. So,
Yeah. How's that feel?
definitely.
It's what we call an anterior drawer test.
Oh yeah, I would definitely say that it moved.
And, okay.
It has some movement there.
Can you do it on your other side for me, just for comparison?
Yeah, sure.
So same thing. This time you're going to take your left hand, put it on top. Take your right hand, put it on the calf, and then quick jolt.
Yep.
Take your left leg and put your left hand and put it closer to your knee. Yeah, right there. That was that one. It doesn't look like it's moving.
If it no, you said it was an anterior drawer test.
Yeah.
No, it didn't really. No, negative.
So that was your good side, so that would make sense.
Both.
Oh, both sides were negative?
Yes.
Okay. So now what we're going to do is, what is it called? A Thessaly's special test. So if you can, I know you said it hurts when you weight bear, right?
Yes.
So I kind of want you to, if you can, get your crutches, have some support. You want to lower you down a little bit more. All right. So you're going to start here. You're going to bend down a little bit and then rotate as much as you can 3 times both sides.
Okay, I'll try it. I don't know if my knee will allow it just because
That's okay.
every time I have my crutches.
Right.
Oops. I started walking and I forgot you, Bob. I'm going to do this one because I have a little sister.
So left looks good.
Yeah. Jeremy, my meniscus tear.
Huh?
My meniscus tear.
Just now?
No, I have one.
Oh. Okay, well, we won't continue with this test. Alright, so for the next one, what I'm going to do, it's got a posterior drawer test. We're going to go into that similar position that we just did. Alright, so you're going to have your knees bent like that, kind of relaxed, slightly bent, heel kind of rested. But this time, what I want you to do is put your hand on the back of your upper leg,